Welcome to Doc Talk, a weekly podcast featuring Monument Health physicians addressing medical topics. Tune into your health with Monument Health. Hello, everybody, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and back again, one of my favorite topics that I had on the podcast was that virus versus bacteria with Dr. John Tronnes, family medicine physician up at Monument Health in the Lee Deadwood Clinic. So welcome back, Dr. John.
Thank you.
Thank you for coming in to talk again. And as we get ready for summertime, one of the things you wanted to throw on this podcast was first aid. Mm-hmm. And the first thing that popped into my mind when I saw this topic, I just got back from vacation, and when you're sitting on an airplane and they start to do the spiel about, here's your seatbelt and your air and all of the stuff that they do if something bad happens, nobody ever listens to it, right?
No.
Everybody thinks they know already. Mm-hmm. And I feel that exact same way when it comes to first aid.
Yep.
That everybody skips the basics. But, man, you need to know this stuff, right?
Yeah, I mean, to at least have a basic understanding is a really good idea. And like you said, like everybody thinks that they know until it happens.
Right.
And then everybody starts to panic.
So you must take this pretty seriously then when
Very
it comes
so.
to, especially living around here, we have so many outdoor activities. Mm-hmm. We go from 60 below to 110 degrees. We cover all of those. Mm-hmm. And as we get ready for summertime, speaking of the heat, one of the big things that's on this list is heat stroke, and I was pretty fascinated by this because I don't think I really know what it is. Mm-hmm. Can you explain heat stroke?
So, I mean, it's a big topic as far as heat stroke because there are, from mild to severe versions of it. But in general, it's just internal body temperature is raising higher than it should be, which causes the body's physiology to do all sorts of weird things, causing it to shift fluid and things like that to places where it ought not to be, to try to cool your core temperature down. And that'll lead to low blood pressure, passing out, end organ damage, things like that.
And I think a lot of people, when they're outside and they start to feel this way, I don't know, I really don't know how many people understand that, something's really wrong, right? Mm-hmm. So what are like some of the initial signs of when you're outside and you're doing yard work, it's 98, you should have got up earlier to do it, obviously, or waited until later. But what are some of the first signs you'll feel when heat stroke comes on?
So your body will, manage heat by sweating, things like that, and trying to dissipate heat. But there will be a point sometimes where the body will stop sweating. That's oftentimes a bad sign where it's like, things are getting a little bit too far. And then lightheadedness, black spots in your vision, things like that.
So stopping sweating. Mm-hmm. What if you're somebody that doesn't, your body would normally do it. Everybody's body should sweat, right? Mm-hmm. Are there ever instances where some people can handle it better and they don't as much?
Yeah, some people handle heat better, and those people might not be as prone to heat stroke as other people. But no, I mean, everybody's going to sweat to some degree from certain parts of the body. And,
Then what's the first step you should take if you start to notice this happening?
I mean, if you're out in the heat and you're feeling lightheaded, you're getting kind of black spots in your vision, get to someplace cool. If you can get inside with air conditioning, or if you can get under a shady spot and try to hydrate as much as possible. The interesting thing with it is that your temperature will actually go up. So your internal body temperature will go up, but the external sources that will often do, like temporal scanners or even oral or ear temperature, won't always be super accurate. So I learned a lot about heat stroke from a doc who managed the St. Paul Marathon. And the St. Paul Marathon happens in July in Minnesota, where the humidity is 80% and the
Have they thought about maybe a different time? I don't know.
I think they should. But heat stroke left and right happens out there, and they'll have human-shaped tubs full of ice to get people into. And he says every person that comes through his tent has to have a rectal temperature done, because that's the most accurate way to find out, is this person's core temperature actually getting up to those scary 103, 104 points. And so, if you get inside and you're trying to cool down and, ice on the head, You can even do an ice bath and drinking water, and you're just still feeling lightheaded, vision's poor. People will get wobbly and shaky towards the end there and get weak. Getting into an ER where we can give people cold fluids and things like that to get their temperature
So that
down.
would be the step you would recommend people going to an ER or an urgent care right away to get in when that's happening.
Yeah, for sure.
All I heard when you were saying this, really going back to the whole rectal temperature thing in a marathon, I'll see another reason not to run.
Yeah.
All right. Well, that again, we don't. I mean, we have a good 3.5, 4 months out of the year maybe where it can be serious here, right? But I suppose heat stroke could happen.
Yeah.
Like in the wintertime indoors somewhere too? Would that be
I've never seen that.
really?
No.
It's more of an outdoor under the sun.
Yep.
Thing for sure.
Body exertion. Seen some mild cases. They have I think a half marathon in Deadwood in the summer, and every once in a while we'll get some, because apparently they like to do a marathon and then go downtown and drink alcohol, which isn't great for your body's internal temperature, heat stroke, and that's when they'll start coming and vomiting. We'll see that sometimes when people get into bad heat stroke. And so, no, I haven't seen a ton of cases here in South Dakota since I've been working here for 2 years. But
really,
yeah, that tends to be the big ones, is where people are physically exerting themselves out in the heat, and oftentimes inadequate hydration will play a role into that as well.
So shade and hydration would really be the two big things you can do. I mean, even if you have to be out in the sun, make sure you've got a gallon of water with you to just keep pouring back. Okay. Well, when people are out in the summertime, and the brief window that we have to get out and really enjoy the nice weather, another thing you may come across are things like spider bites around here, which I was kind of surprised. Snake bites too, obviously. We do have a fair number of. Have you seen those in your practice?
I have yet to run across them. From what I hear, prairie rattlesnakes don't really come up into the hills up in Deadwood.
Okay.
But it was something that I definitely learned up on coming out here versus being in Minnesota, where there are no poisonous snakes in Minnesota, at least not native poisonous snakes to Minnesota.
Right.
So coming out here, I was like, oh, there's rattlesnakes out here, and I should probably know more about. And then once I got to Deadwood, they were like, yeah, they don't. They're in spearfish. You'll see them in spearfish. You'll see them in Rapid City, but you don't see a ton of them in Deadwood itself.
Sure. Up on the hills in general, I don't think you'll run across a lot, but spider bites is kind of interesting.
Yep.
Because it wasn't until recently, I don't know, maybe in the last 10 years, it was the first time I had ever seen a black widow spider in my garage. And at first, it's kind of shocking, because you've always heard the dangers of these things, which I'm sure there are. They're not generally fatal, are they? Spider bites?
Not the ones around here.
Okay.
Are not typically fatal. Even with prairie rattlesnake bites, they're not overly fatal as well, unless the venom itself, gets directly into your bloodstream. And so with the spiders that we have here that can cause issues like black widows, brown recluse, and the snakes, which is the prairie rattlesnake, their venom tends to be a local issue, so it causes a lot of skin breakdown, tissue breakdown, and that can spread pretty easily locally and cause a lot of local swelling and issues like that. And so you'll see people who had a bite and their hand will swell up, or their whole arm will swell up, and you'll see tissue breakdown, big ulcerations of the tissue and wounds and blisters and things like that.
So with a snake or a spider bite, are they similar treatments when something like that happens?
Yeah, I mean, in both cases, you're going to want to seek medical treatment, right? And there are a lot of kind of old wives' tales about how to treat these things that don't necessarily apply.
I'm assuming the first one you're going to is sucking out the venom?
Don't suck out the venom. Don't make incisions over where the wound was. Don't try to suck out the venom. Tourniquets for bites. People will say like, oh, tie off a tourniquet to the arm so it doesn't get to the heart and spread. Not true for the types of creatures that we have around here. There are some cases in certain species of snakes and things like that in Asia, Australia, where that might be reasonable to do, or some version of that. But here, it's essentially, especially like snake bite, which people are usually going to know right away that it happened. Spider bites so often when I see them, it's woke up in the morning and I see this, or I was out camping and maybe even a couple days later I started noticing this, because it can take a little bit of time for that wound to develop for people to actually notice it.
Okay.
But snake bite, get a bite. They recommend trying to get that wherever it got bit, most of the time it's either going to be a leg or an arm or hand, something like that. Get that in a neutral position. So put the arm in a sling so it's resting and not moving. The more muscle movement you're going to have in that extremity, it's going to work that toxin, that venom around and cause more tissue breakdown. Or if that leg, try to get it straight in a splint if you can, and get help so that they don't have to put weight on it, so they don't have to use that leg, and just try to get into an ER right away.
Boy, I don't think anybody has ever heard that that's what you're supposed to do. I think that wives' tales are so prevalent.
They're very prevalent, yeah.
That's so interesting that's how you handle this. I did, as a kid, was bitten by a brown recluse right here above my wrist, and it looked like about a half of a golf ball had flamed up on my arm, and without being too graphic, the stuff that came out of it was disgusting.
Yeah, and that's all just, the venom will just break down the tissue, so it just essentially liquefies and comes out eventually.
Yeah, it was terrible.
And those wounds can be prone to infection, so oftentimes it ends up just being proper wound care, either through your doctor or through a wound care specialist that a lot of hospitals have around here. And then antibiotics.
Yeah,
and,
I remember taking a lot of pills just to fix that. But I remember the pain. It hurt.
Yeah.
All right, so after you've survived your spider bite or your snake bite, or you just avoided it altogether, maybe you were running away and you tripped and fell down the hill and ended up spraining something, right? That can be next on things that happen around here quite a bit. Real quick, speaking of wives' tales, is it true that it's better to break your ankle than to severely sprain it?
So, with that, I wouldn't say it's better. It heals faster.
The break does?
Yeah, broken bones. So on average, a broken bone will heal in 4 to 6 weeks, depending on how old you are and how good your bones are. But they say that soft tissue injuries, like a severe sprain, can take upwards of 12 weeks before that ligament is looking back to normal, or before you're able to kind of move. That's why you'll see, pro athletes, I always talk with this with my patients about pro athlete, you'll see them, they pulled a groin and they're out for, 8 weeks, 9 weeks. And you're like, it's just a little strain, a little sprain, shouldn't be that bad. But no, the ligaments and tendons, they don't have a lot of good blood supply. And it's that blood supply that kind of brings healing factors from the body to that area. And so that's why it takes such a long time for those things to heal.
And your bones do. And your bones much better blood supply.
Bones are very vascular.
Okay.
Yep. And there's a very good mechanism in your body to heal broken bones.
So if you get a sprain, a sprain can happen ankle, wrist. Like where else on your body can sprains generally happen?
Anywhere.
Really? Okay.
Yep. I've seen sprained back, sprained knees, sprained ankles, fingers. Finger sprains are very common. People, got caught and stubbed their finger, or, a ball came, they tried to catch it and, hit the end of their finger.
So then what happens with those in those instances? Sprains, ankle sprains, I know if they're severe enough, surgery sometimes is recommended in those cases. But on fingers and things like that, then what do you do when something like that happens?
For kind of the finger ones in particular, splinting, it tends to be the first care. And so when you're talking about first aid, having some kind of splint ability, if you do have a first aid kit, is probably a great idea. And they do make a lot of easy packable, like they'll have like these foam rolls that have like a malleable metal part in the middle that you can roll up, put into a first aid kit, unroll, and that way you can get something kind of in a neutral position, flat, immobile is essentially what you want, and then go get it evaluated so that, a physician can say, this is probably just a sprain, or I'm worried maybe that something's broken, let's get an x-ray. I get a lot of kids in that, out on the playground, hurt their ankle, hurt their leg, something like that. Teacher, parent says, it's just sprained, you'll be fine. 3 days later, they come in and they say, actually, it's broken. You've been walking around on a broken ankle for about 3 days now. Yeah.
So immobilization is kind of a big step on most sprains then?
Yep, yeah. And so having some kind of thing that you'll see Boy Scouts and, outdoorsmen use a stick and tape or something like that, something that you have on hand. But they do make, splint material that's pretty easy to get access to, and you can put in a first aid kit. That's pretty great. And I know we have Terry Peak up by Lead and Deadwood, and you'll often see people come in with that kind of, that's like a foam roll, has a metal insert in the middle that kind of is malleable, so they just kind of, whatever joint's the problem, they just throw it on there, throw some ACE wrap around it, immobilize it, and then send them down the hill to our ER.
Just push them right down to ending up there. All right, so another big, this can happen throughout the year, obviously in a lot of different situations, but when summertime rolls around, people head out and start to go camping. The one big thing that everybody loves to do is sit around that fire. right? That's a big deal for us around here. And then that can lead to some idiot getting burned. Don't mean to call anybody an idiot, but I mean, it can happen to any of us, right? So burns, I mean, they can be, we've all been burned to one degree or another. What's best on first degree burns? I'm assuming it's more of just pretty general care, right?
So the first thing with any burn is getting the temperature of it down as soon as you can. So
that is
cold running water.
That's a true thing.
Yep.
I maybe would have thought that might have been a wives' tale too.
The old wives' tale is butter, butter for burns.
Yeah, maybe that's it.
Don't put butter on your burns. And so, no, getting it under cold running water as soon as you can, because that thermal injury that's happening to the skin and the structures underneath it, will slowly spread, and you'll kind of see it like, okay, it's really bad here. Maybe that's where you'll get your blisters or the skin will break down. Not so bad out towards the edges. And if you can get it cold as possible, as soon as possible, you'll reduce that spread of that thermal injury. And so you can try to get that down as much as possible. But get it under cold running water, they say about 10 minutes, especially if it's a significant burn. So just cold running water for 10 minutes, and then, gauge it, and if you think it needs to go in, go in. Burns that are particularly scary are ones that involve joints, like if it wraps around an entire joint, because if that heals improperly, it'll make that skin really stiff and really hard to move.
Now, when you say wraps around a joint, like what do you mean?
So let's say like someone's hand got into a boiling pot of water or something like that, and it's going to involve, joints around the knuckles, joints around the wrist, and so all that skin will get burn damage, and it will eventually turn into scar tissue and things like that. And so getting those to adequate burn centers is important, which is tough around here because we don't have a burn center in South Dakota. They all end up going down to the Denver region.
Is that the closest one to us, probably? So what are the, real quick, if you can, what are the, you always hear first, second, third degree burns. Yeah. What's the differences between all of them?
We don't even call them that anymore.
Really?
Yeah. No.
Oh, man. I'm going to title this The Old Wives' Tale, a first aid episode.
But it was essentially the depth was what it caused. And so we call them superficial burn, partial thickness burn, full thickness burn.
Well, I can't remember that.
Yeah, first, second, third, it's so much easier, yes. Yeah. And so I never hold it against people. But that's what we call it in the medical field nowadays. And it's essentially just how much of that skin tissue, so, the skin has many layers to it, and essentially how deep do we think that burn is going? And they'll have kind of classic signs of like, if it's this deep, you'll start to see blisters. If it's, all the way down to the bone, it'll look like this. And so there's ways that we can kind of gauge it and severity, but, that kind of simple sunburn is kind of that superficial, that's maybe just into that epidermis-dermis layer. And then you're going into that partial thickness that's going down through the dermis, might cause some blistering and things like that.
So at what type of burn would you recommend that people see a doctor generally? Probably
partial thickness. So anything that might start to blister, or like I said, anything that involves large portions of the body. So if you're saying like, this is pretty wide and big, or if it's involving, joints and things like that. So, I've had people where it's not so bad, but it involves their entire finger. And we really got to care for that well to make sure that they have full movement of that finger, a year from now.
So if somebody's out camping and they can't get to a doctor right away with a burn like that, what do you recommend? I mean, in a first aid kit.
Yeah. Like I said, cold running water, and then they'll have burn creams, burn gels, things like that can help, and then just keeping it covered, because burn tissue is going to be more prone to infection, might blister and then open up and then have open wounds. And so keeping it covered, especially if you're going to be outdoors like that, and getting in somewhere.
Okay.
I know one that's pretty popular is Silvadene cream, which is kind of like a silvery type based cream, which is great for preventing infection. Long term, it might slow down healing, by a week or two or something like that, but it can also be helpful for just preventing infection, especially if you're going to be, I'm out here for 3 more days and I can't get anywhere.
Right. Okay. Excellent. All right. I'm going to combine these last two here a little bit. Because everybody is going to experience that this year too. Hopefully you'll avoid the sprains and the burns and the spider bites, but cuts and scrapes, puncture wounds, things like that are going to happen to all of us as we head out this summer, right? So cuts and scrapes. My main question with this, people will always say, well, put like a Neosporin on it right there before you cover it. But then lately it seems like you've heard a lot of stories about, well, no, don't use that stuff. What's your take on that?
And anti-Neosporin,
okay,
believe it or not, yeah.
And why is that?
So Neosporin in particular has like their proprietary blend inside it that actually can cause some skin irritation.
Okay.
And what ends up happening almost without fail, they'll have some kind of wound or cut or abrasion. They put their Neosporin on it for 3-4 days. Then they come see me and they say, it's getting really red all around it. And I can't tell you then, it's like, okay, is it getting infected and do we need to start antibiotics? And kind of in that realm of, we don't want to put everybody on antibiotics.
Of course.
Because of antibiotic resistance. Or is it just irritated because of all the Neosporin? Neosporin and hydrogen peroxide.
Oh, that's another big one, yeah.
Hydrogen peroxide, I think it's maybe a generational thing. But yeah, people love to pour hydrogen peroxide on things. And as an immediate treatment, I say, okay, maybe like right when it happens, you can just quick rinse it with hydrogen peroxide because it does, essentially, it's indiscriminate killing of tissue is what it does. So it'll kill bacteria and viruses, but it'll start to destroy your own tissue as well. But I have people who are saying like, oh yeah, I treat it every day with hydrogen peroxide and it's looking pretty gnarly. And I'm like, yeah, it will. It will.
There's a reason. What's the point of hydrogen peroxide then? What's it good for?
I mean, I don't know. I'll keep it in the house. It helps break down earwax.
Oh, all right.
So you mix like half and half hydrogen peroxide and water, and you drip it into your ear. It'll break down earwax.
Big difference between the cut on your hand and your earwax.
Yeah,
for sure.
Yeah, and like I said, as like a one-time, okay, just got the wound, pour a little over it. Sure, why not?
Okay.
But yeah, long term, if you're going to put something on a wound, I say just do straight Vaseline, Aquaphor, just an ointment that doesn't have any kind of medication in it, or yeah, you can do like a bacitracin antibiotic ointment, but I'm not really a big fan of Neosporin for wounds.
I've been hearing a lot about Aquaphor recently. Yeah. I don't know why. That's like outside of Vaseline. When a lot of people like lip dryness and things like this, I've heard Vaseline or Aquaphor. What's not to get too sidetracked here, but what is?
So a lot of things that people put on their skin, they think because they're like, oh, I'm trying to hydrate my skin, but large portion of that top layer of your skin is just dead tissue that can't really absorb anything. They're just dead skin cells that are just causing that are just a barrier. So your skin has a great barrier. So not a lot of things actually get into it. Your body will try to get stuff out to the skin if it needs to. And so Aquaphor and Vaseline are just a barrier to prevent water loss through the skin essentially. And so you put a barrier there and the body will take care of itself from the inside out. You're not really expecting a lot of that to go from outside in.
Okay. Now, so you've got a cut or a scrape. Do you recommend covering it, Band-Aids, things like that? Is that necessary?
Yeah. I mean, for open wounds, especially if a scab hasn't, or if it's, still bleeding, try to get that covered. And then just depending on what the wound looks like on whether or not you need to get in to be seen for it. So.
And don't pick scabs, right?
I don't recommend it. No, okay. I mean people are pickers, and so people are going to pick. But no, just the scabs will fall off on their own eventually. Okay. They're there for a reason. But yeah, I mean if you get like a simple scrape that's just wide and shallow and maybe has a little bit of bleeding, you can just treat that. Ideally, I say just water, mild soap, and then you can do that once a day. And then while it's still kind of actively open and oozing and bleeding, keep it covered. And then if it's kind of scabbed over and dry, you can keep it open. If it gets real dry, you can just do a little bit of Vaseline or Aquaphor on it.
Okay.
For puncture wounds, which is any wound that's deeper than it is wide, so dog bites.
That's a good way to describe it.
Bites,
okay, yeah,
human
bites. Oh my God. Okay.
Those ones are real prone to infection because what the body likes to do is seal up the very top of it because that skin's kind of close together and not very wide, but it leaves a big pocket underneath that can get infected, especially with bites. A lot of bacteria will get transferred, and so those ones you should get in and be seen. And possibly be on antibiotics to make sure it doesn't get infected.
So anything deeper than it is wide.
Yeah.
That's a really good rule of thumb then for that.
Yeah.
Okay.
And then cuts, for those ones, it can be a little bit tough because if it's real shallow, no, you don't necessarily need to come in to get it stitched up or anything like that. But if it goes into that dermis layer or if it's not closing, so if you look at it and kind of gaps open and it's not closing naturally, those ones usually need stitches in it. The other rule of thumb is that if we can't get anything to stop bleeding, then we'll start throwing stitches in it to try to get it to stop bleeding.
Okay, so as we've covered most of these things you might see this summer, what ideally do you think everybody should have in a first aid kit? I mean, because obviously you can buy some that I've had. Got countless. I've thrown out so many because you've got so much stuff in there. But do you really need all of that?
I mean, a lot of it's probably just to sell you stuff, kind of. And then the other part of it is that some of it will expire, and then making sure that you're changing things out. But ideally, I would say something that you can make a splint out of, especially if it's going to be on the back end of your side-by-side or four-wheeler or something like that. So something that you can make a splint out of, something like a ace wrap or something like that you can use to tie things down or immobilize things or make a quick sling out of. Something to help, if you do get bleeding to start, something to help stop the bleeding. So gauze is probably the most, so just, thick, cottony pads essentially that you can, especially if it's a big bleed, to get pressure on it right away and just put as much pressure as you can to get that bleeding to stop. Like I said, a burn cream or a burn ointment or something like that is probably a good idea. You'll probably end up having some kind of antibiotic ointment in there as well. That's honestly, you don't need a ton more than that. I have a lot in mind,
right?
Because
I would hope you would.
I mean, I keep like skin glue on hand, which you can't always easily get to, but there are some, equivalents out that you can get just kind of at any pharmacy or Walmart or things like that, liquid skin and things. So
okay, so another wives' tale, super glue. Could you use that in a pinch?
You could use it in a pinch, for sure.
Really?
Yeah, you could use it. It's more irritating to skin, so it can even kind of cause like a little bit of burn, like chemical burn to the skin if you use it. And I'm always wary of telling people to do it because there are certain things that we're willing to glue and certain things that we're not. So if something, the classic one is, okay, I was cutting vegetables and then accidentally slipped a little bit and cut my finger, and you'll see it's not really like a deep straight cut. It's kind of more like a slice through it, and the skin will lay flat back on the finger. And so as long as it's just laying there, everything looks fine. Those ones are perfect for just doing a little layer of glue over, and it'll, work great for you. Glue usually falls off on its own after a week or two.
So is there an over-counter version of that skin glue?
There's liquid skin, or like I said, super glue in a pinch.
Wow. All right. Well, we busted a ton of myths, I think, today, and hopefully people won't put butter on burns and all the rest. Anyway, Dr. John Tronnes is a family medicine physician up at Monument Health in the Lee Deadwood Clinic. Thank you again for coming down and talking about this, because
glad to be down here.
I think this will it'll help. Oh, the one thing I didn't get to. I wanted to talk about tick bites. Oh, yeah. Just a little bit, really quick, before I wrap this up, because forever, this has been my biggest fear hiking around here, and you told me, stop it. It's not that big of a deal, right?
I guess it's relative. Where I come from in the northern Minnesota woods, you can't walk 10 feet without getting a tick on you.
Right.
I've been out here quite a bit and have yet to see a tick. I think I've only had one patient in the last 2 years that ever came in and complained about a tick.
No kidding.
Yeah. So they're just not as common. And then probably the biggest concern with people and ticks is Lyme's disease, which, if you look at CDC has maps, and you'll see okay, here's where all the Lyme's disease is, which is especially northeast into kind of the Minnesota, Wisconsin area, and it kind of stops at the Missouri River. And those ticks that carry Lyme disease haven't quite gotten out here West River yet. It might happen in the future, but at this point, it's not something that we're routinely concerned about. I used to see, you target rashes of Lyme disease 3-4 times a summer in Minnesota, and you just don't see it out here unless someone's been doing some traveling. There are still some other tick-borne diseases that can happen, Rocky Mountain spotted fever, anaplasmosis, that are carried by different ticks. But the main thing with tick care is that lots of people say, burn it off or something like that. But the routine is get a tweezers or a needle nose pliers or something like that, get as down to the base as you can near the neck head that's going to be buried into your skin, and pull straight out. That's essentially what the official recommendation is. And most of the time you'll be able to get the entire thing out without any issue.
Excellent. Yeah. Okay. Well, I'm going to try not to be afraid the rest of the summer, but I'm still going to be tucking my pants into my whatever shoes I'm wearing for sure. All right. Again, Dr. John Tronnes, thank you very much for coming in. And I know we're going to have you back. I think the next time we talk, you and I are going to be talking about adult vaccinations.
Sounds good.
Which I think is pretty important to talk about too.
Very much so.
All right. Thank you very much, Doctor.